So in Denver, hospital officials are saying, hey, our hospital system, this is not sustainable long term. We may have complete breakdown because of the amount of resources needed to take care of all of the illegal newcomers to the city of Denver as a sanctuary city. Let's get into it. Here we go.
Tonight, one of Colorado's largest hospitals facing a crisis. Physicians at Denver Health telling us they treat everyone who comes to the ER regardless of immigration status or ability to pay. But they're struggling to handle a spike in migrant patients.
It's been really, really hard to take care of them, both in terms of their inability to pay, but also just the sheer volume of patients that we weren't expecting.
Denver has a population
that we weren't expecting. Okay. All right. And you bring a whole bunch of people that have been malnourished and their big walk through wherever it is, Central America, South America, through Mexico. They're eating and drinking food that they're not accustomed to. They're not getting the right nutrition, a lot of bad water. I mean, you got a bunch of sick people rolling into town. How did you not think that there was going to be a big percentage of those coming into your city that are going to need some help? I mean, just sheer numbers alone, right?
Of 700,000 people. In just the last year, nearly 40,000 migrants have arrived. The mayor declaring a state of emergency.
More than 8,000 migrants have come to Denver Health for care, and most of that is coming out of the hospital's pocket.
The hospital says they need more help from federal and state government to pay for over $10 million in unpaid migrant medical bills so far. Outside a shelter, we meet 𝗪𝗓𝗧𝗛 and her 3 sons. She's being treated here for Parkinson's. I'm very grateful. In my country, it was very difficult. We were not able to get medicine for my condition, she said. Emergency room pediatrician Dr. Christy Rodriguez says they want to give patients the care they need, but they need funding with the hospital facing a breaking point.
Is this an emergency here?
I think it's about to be. I think this isn't sustainable how it is right now.
Meanwhile, Denver's public schools are also scrambling to keep up, with nearly 3,000 new migrant students.
So we've had around 100, which makes about 20% now of our student body. Now, over time,
Principal Brian Clark's school now receives 5 to 10 new students per week, what they used to get in an entire year. Now, some classes have hit the 35 student limit, so some students have had to be transferred to other schools.
Come February 5th, the city says they'll start restricting stays on migrants in shelters and kicking many of them out onto the streets. Some migrants we spoke to said they don't know where they'll go. Lester?
Denver hospital system told the city Monday it faces unprecedented challenges due to the ongoing migrant crisis. But, you didn't have to be a sanctuary city. That's the thing. That's the rub, right? Plenty of cities who did not. We don't have to have millions pouring across the border, unchecked, unvetted. It doesn't have to be a thing, right? It doesn't have to be a thing. You could do what Texas is doing. And they're having very few illegals come through the Texas border. They're having some. Because you can't, it's 1,254 miles of frontage on the Texas-Mexico border. You can't continually, make sure nobody gets across that. But you can put a lot of pressure, and that's what Greg Abbott has done. Put a lot of pressure on that sector. They're going to go up to Tucson area in Arizona. They're going to go to San Diego. They're going to go to California. They're going to go elsewhere, right? That's the deal. Denver Health CEO Donna Lynn warned the center is in a crucial moment due to unexpected costs associated with immigrant visits. But you had to know, on some level, all right, you bring XYZ number of people into the community. Just statistically, all right, a certain percentage of those are going to be pregnant, right? A certain percentage of those are going to have babies. A certain percentage are going to come with pre-existing conditions. And maybe that's some of why they left home, because they weren't getting the care that they need. And I am, I want to help those people too, but you've got to have a sense of budget. You've got to have a sense of what can we actually handle here? What can we do where we're not, pushing out our own people out of the way to get to these newcomers, because we're just so worked up and so excited to help the newcomers. We're forgetting about our own vets. We're forgetting about our own homeless. we're just, booting people out left and right. And then literally my previous podcast was asking private landlords would you take some illegals into your properties? Would you rent out to them? Oh, and by the way, here's the kicker. Yeah, we got just a little scooch of a rent cap. It's at $2,000. So if you'd rent to them for $2,000 or less below market rate, that would really help us out. The hospital closed 15 beds, reduced raises, and postpones renovations after losing $2 million last year. And is it those hospital employees' problem that they're being overworked? And now all of a sudden there's no more raises for you. You guys are working too hard. We know you're overworked, but we can't give you a raise because, gosh darn it, we are bleeding out millions here because we're a self-proclaimed sanctuary city. Because our costs exceed our revenues, there's that whole budget thing again. Costs exceed revenues. We're turning down patients every day, particularly in the area of mental health and substance abuse. Okay, so your folks just running the streets on the Fetty, they're just going ham because there's no resources for them, right? You basically said, you're not worthy, the migrants are, and that's what we're going to work with. 8,000 migrants from Central America accounted for approximately 20,000 visits in 2023. Denver Health asked the Federal Emergency Management, FEMA, to provide funds for immigrants' medical costs. The state and federal governments aren't reimbursing the hospital, which spent $136 million for patients who didn't pay. Wow, $136 million for patients who didn't pay. So much money, so much money. While I have a tremendous compassion for what's going on, it's heartbreaking. It's going to break Denver Health, Lynn said, according to the Denver Post. I have this talk with folks all the time, and people are a lot of folks just don't, or they don't want to either understand or recognize that rents in large part are based on acquisition cost. All right, I can buy that one knowing I can rent it out for XYZ. So you need to rent it out for a minimum of whatever you had projected on the purchase, on the acquisition. When I have these emails and comments, if we could just reduce the amount the rents are, if we could just get to some reasonable rents. Well, who's going to do that? Are you going to just take, money out of your wallet and hand it to somebody? This is how we're going to make things reasonable. This is how we're going to make things manageable. The landlord's got to come down in their rent. Why? They paid big bucks to acquire it. This is the rent that makes their system go. You got a little component in there called profit. You need to make that too. Because this isn't just, a do-good socialism works for those who don't type experiment. This is reality. So whatever the thing's going to rent for in the open market, that's what they're going to rent it out for. This whole concept of, if we could just get the landlords together, just get the tenants together, somehow we'll work something out in the middle. That's never going to happen. Never going to happen. Tenants got to pay, and landlords, they're on the right end of this because there's such a supply, especially in these big blue liberal cities. There's a supply component that just isn't there and huge demand. So all of this, let's cap rent. Let's do subsidized housing. Well, you've only got so much money to do that, right? And then you got to let the market rip. And that's what it's doing. And it's basically saying, this isn't a good place to be, on drugs on the sidewalk, because this isn't a good place to be an entry-level worker with no real job set. You're not going to find housing here. It's just not going to happen. Not going to happen. And everybody else is like, if we could just get this to go somehow. And I'm like, how? What do you? Well, if the landlords could drop their prices, and if tenants could just be more, you're like, okay, what does that really look like? What are you talking about? How's that work? I'm in real estate. You rent it out for what you can. You get top price because that's what you need to make it a viable investment. Anything else is just nonsense. It's just, we're just talking, just babbling. We don't really know what we're saying. Because in reality, you can cap rents all day long. Nobody's going to rent to you. Subsidized rents. All right. Yeah. You don't think the minute somebody gets their hands on that and they want to turn it into something else, they will? I think the city of Denver should do more, but the state also has to step in. according to a Denver Post. Denver Health is the safety net provided for the whole state. They're taking patients no one else will take. That is their job. That's their thing, right? But they've just had a massive rush of people coming in to the area. Denver Health at critical point is 8,000 migrants make 20,000 emergency visits. And we talk about that fairly often on this podcast. You're not just giving them a coat and a hat and saying, hey, good luck out there in Chicago weather in winter. It's everything else that's associated with being a human being. It's all those costs. You got, little Johnny and Susie came with you as a newcomer. All right. They got to go to school somewhere, right? So you got school expenses for them. You got some food expenses for the kids at school. You got food expenses for mom and dad. You've got clothing. You've got medical. And those are the bare necessities. And without a work visa, these people don't have the ability to support themselves. So these big sanctuary cities, just bring them in. Well, yeah, but you can't afford it. So all of this virtue signaling breaks down. And that's what we're seeing right now. We're seeing the breakdown of the virtue signaling and, I got to cut these shelters, got to get rid of the shelters. And by the way, could you help us out with some affordable rental housing, 2K cap tops? Denver hospital system is turning away local residents because it is flooded with migrant visits. If you're a local, how does that make you feel? How does that make you feel? You can't get your own health care, and yet the illegals the newcomers, they're getting priority. What are we doing here? What do we got going on? How does this make any sense at all? How about you just protect that border like Abbott is doing? You don't let millions run across. How about you do that? I don't know. Because California is not doing that right now. Phoenix or Arizona certainly isn't doing that right now. We'll just see how it works out. They're already pretty close to Denver, aren't they? Yeah, West Coast, Best Coast. Here's another interesting stat. The health system is overwhelmed with care costs for uninsured patients, particularly migrants. 36,000 of whom have arrived in Denver since December of 2022. So in a year and a half, you've had 36,000 newcomers come to the city of Denver, and they don't have resources. They don't have, they're scratching out on the intersections. They're doing that clean the windshield deal because they want to work. I believe many of them want to work. They've come here with a strong work ethic. Say what you want. They're just all freeloaders. Okay, you can have that opinion. But I think a bunch of them are going to work too. That's just kind of built in with them. But with that being said, you bring in 36,000, you're going to have a bunch of no good people. You're going to have a bunch of gang members. You're going to have a bunch of convicted felons. You're going to have people that are going to be expensive to house. You're going to have people that are committing crime. Just numerically, bear with me. Statistically speaking, you're going to have a crap ton of people come through that aren't going to have the interests of Denver at their best heart. It's going to be all about them, right? You're going to have that. And then everybody else who's in between is expensive as well. They've got to eat, got to live somewhere, transportation, getting around. All that stuff requires money, right? So it's one thing to do this virtue signaling. We're sanctuary city. It's another to really back up that claim and say, all right, here's how we're going to handle it without relying upon, basically private parties, without relying upon other citizens or relying upon the federal government to step in. Because the federal government hasn't really said, hey, you know what? If you could just take some of these folks off of our hands, we'll help you out. Here's the contract. Boop. Yeah, no. Where do you think the migrants are getting care? They're getting care at Denver Health. Her remarks were reported to CBS Colorado on January 12th. So you've got 8,000 people totaling about 20,000 visits, and they all lack legal documentation. Majority are coming from Venezuela and arrive needing treatment for chronic and communicable diseases after making the difficult journey. Right now in Chicago, we've got an outbreak of measles. Yep. Measles. Yeah, talking about measles. I mean, that's a different story there. Measles outbreak hits Chicago migrant shelter, prompts lockdown for any who haven't been vaccinated. The problem is they're coming here and they're not vaccinated. So They don't have the right vaccinations for where they're at geographically. All right, you might get a little measles thrown out there. I hope you're vaccinated. That's not a big deal to get vaccinated, but they come here and they're not. So their kids are getting sick, getting the measles. So to put this in comparison, in 2020, the health system, Denver Health, had about $60 million in uncompensated care costs. All right, so $60 million. Last year, the cost sprang to $136 million. So more than double, a quarter of which came from caring for non-Denver residents. So you just had a massive pull on the healthcare system, just like the school system, just like the housing issues, just like the job market. I mean, they need employees, but if you're illegal, you don't have that work visa. That means you're doing something shady. You're doing something off the books. You've got so much of that going on. So I blame the leadership in these big blue Western cities, in these big blue, I shouldn't say Western, but in these big blue Democrat-run cities for just not having this planned out, not having the resources ahead of time. But man, they took it upon themselves to just rake in all the glory at the onset of this, right? It's going to be greatest thing ever. Now you're cutting beds. You're, having to move kids to a way further school because we're all tapped out here. We got our 35 and now we're all, there's no more room at the inn. The inn only has so many rooms. And that goes not only for just housing, it goes for everything else in life. And these big blue cities have just, they're just scrambling from one crisis to another. Can we get through winter without anybody else dying? Can we get through winter without another 5-year-old dying? Yeah, you've got so many of these storylines, or being raped and killed. I mean, good Lord. Say her name, right? President Biden couldn't even say her name correctly. Called her Lincoln. Oh, so bad. I told you guys I was going to listen to the State of the Union address. I lied. I listened to, maybe a 5-minute segment, maybe 10-minute segment. It was so bad. I could not watch anything. It got to 6:30 here my time, and I realized it had been on for about half an hour. And I'm like, I'll tune it in. I'll watch it. But bottom line was, I couldn't take it. It's so bad. The content is so bad. Trying to convince us that everything's great and hunky-dory, that everything's just, the best thing ever. Totally minimizes everything at the southern border. Just, one cluster after another. And if you would have heard the people cheering there, I mean, they're standing up, clapping like, absolutely horrible. That's your president. So expect more and more of these stories to come out, because this isn't going to get better overnight. You're going to have some of these migrants, they're going to get their work visa, they're going to go live wherever, they're going to do their thing. But there's only so much room, there's only so much capacity, so much bandwidth for them throughout all these sanctuary cities and wherever it is that they're going. And with what is more than likely a big influx of newcomers to the United States here this spring and summer before the election, I think you're going to have a big run of those numbers. I think you'll have a big run. If you don't, it's because, Mexico's been pulling back. Mexico's helping out. They usually only do that for a few months at a time. And all right, we helped you. You're on your own. Figure out that southern border on your own there. Hot stuff. You know what I mean? And they intermittently come in and they'll have their National Guard, their federales kind of patrol the border. And that's some of what you got going on right now. But as the weather heats up, we know that the totals are becoming more and more. We went up from a total of, I think, 126,000 at one of the checkpoint Charlies to 140,000. But we know the numbers are escalating. Will they get to that 302,000 that we had last Christmas, last December? Who knows, right? Who knows how many are on their way right now? Who knows? I have no idea. But with the numbers that I saw in the whole Darien Gap thing, you had the guys running the boats. They took a little breather. I think they got arrested. Is that what happened? They got arrested. Anyway, they they got shut down temporarily running those boats to the Darien Gap where people make that big hike. And it really caused a, kind of, all right, yeah, the whole migration thing isn't really working out that well because you get this little stopgap in Darien Gap and people aren't able to navigate through there. But with the quite literally hundreds of thousands that are on their way, so many are going to want to get in, I think, before there's a chance that Trump comes in and wins the 2024 election. And he stated, he won't be able to do it, but he stated, we're going to have the the biggest expulsion of people from the United States ever. He stated that. So I think if you're looking to get into the country and you've been kind of just waiting to see how things go, you're going to make that move this year. You're going to have literally thousands and thousands of more of these folks hit systems like Denver who are already overwhelmed and have tapped out resource-wise, not only housing, but schooling and, healthcare. And those are three of some of the major ones, right? So expect to see this continue because these folks aren't going away and we're bringing even more of them into the country. I mean, I'm sure it'll work out fine, right? I'm sure it'll work out fine. Yeah, it'll just sort itself out. This is how it sorts itself out. Now, healthcare system's about done. It's about toast. You're going to have some federal intervention. You're going to have some federal funds, but that's not going to be a good look politically either, right? Hands are kind of tied there. There's been massive amounts of these mayors and governors requesting financial assistance from the federal government. And so far, it's just been crickets. Like, yeah, figure it out on yourself. You guys were self-proclaimed. We can't have this look on us of now we're helping you out because you guys self-proclaimed that you're sanctuary cities. That doesn't help us out, the federal government. We gotta have all of our resources so that we can have Customs and Border Protection, do their Uber service for the illegals into the country. We gotta fund them. Yeah. All right. That's it for me on this one. Thanks so much for being here, but we'll have tons more of these stories coming down the pike because this isn't going away. Numbers you read there, that's not going away. These are human beings. They don't just disappear. You're not like you can put a whole bunch of, automobiles in a shed and hope they do okay. A little rusting never hurt anybody. Not like that, right? These are people. These are human beings. So thanks again for being here. Thanks again for supporting, and I'll catch up with you in the next one. Bye for now.